Radiology is the specialty of medicine that makes a diagnosis using imaging tools such as X-ray, CAT scans, and MRI scans. Dr. Michael Brant-Zawadzki of Hoag Memorial Hospital Presbyterian in Newport Beach explains what treatments an interventional radiologist can do once a diagnosis is made.
Radiologists are physicians who are trained to make diagnoses using imaging tools such as X-rays, CAT scans, and MRI scans. Interventional radiologists are further trained to use those tools to intervene in the body, treating a variety of disorders throughout the entire body. Neuroradiologists, who are interventionalists, are subspecially trained to intervene inside the skull and in the spine. The commonest disorder that interventional neuroradiologists deal with is stroke. Stroke is the third leading killer in this country and second worldwide. It's a very common cause for admission to the emergency room in every hospital across the nation. Interventional neuroradiologists not only get involved in diagnosing the two major causes of stroke, but also in treating stroke, particularly if caught in the earliest stages. Neuroradiologists who intervene in stroke can help by opening up blocked blood vessels that deprive the brain of flow, or in other cases where there's a rupture of a blood vessel in the brain, they can go in through the arterial system under image guidance and seal off that rupture. We now have CAT scanners that can scan the entire body in wafer-thin slices and let us evaluate various disorders, and particularly in the brain, which is a relatively small organ, having very thin slices is important to evaluate various disorders such as stroke. By using this machine, we can actually scan the brain in a matter of seconds and make very rapid decisions, which are critical in the early stroke setting. Endovascular is the term used to mean that we're working inside the blood vessels. Those tools consist predominantly of very thin tubings and wires on the order of the smallest angel hair pasta strand that you can imagine. The wire is thinner than a guitar string, and navigating those by remote control, if you will, from a puncture site at the upper thigh, which does not require stitches after we're done. By manipulating those tools, we can advance them to the very distal parts of the circulation inside of the brain. We can also treat blockages in blood vessels leading to the brain, such as those in the neck, which may cause strokes or place patients at risk for stroke. In many instances, these procedures have replaced conventional surgery. So not only have these techniques replaced surgery, but in fact have provided a surgical, minimally invasive methodology that didn't even exist before. Hoag is one of the few area hospitals that does have the capability to provide neurointerventional care, as we mentioned. There are two highly specialized neurointerventionalists with over 40 years of experience between them. There is a whole team in place. There are in-house neurologists who spend all their time in the hospital to help care for the patients who have these neurological disorders. And Hoag has an excellent emergency room that is trained to respond rapidly to acute stroke emergencies.